Just 5 minutes.
Thank you. I appreciate it, Mr. Chairman. This is a great hearing. I thank the witnesses. One area that I'm interested in is the role of AI in drug development, particularly in the rare disease space. Scientists have developed AI models to identify drug candidates from existing medicines that could be applied for rare diseases with unmet needs. The innovation is just the beginning, and we should continue to explore similar applications to improve our healthcare system. Most people agree with that. The question is from this is for Mr. Toy. Your testimony discusses your personal experience as a rare disease patient. Thank you so much for sharing your story. It really means a lot to the community. Can you share further how AI will continue to accelerate the patient diagnosis journey, please?
Absolutely, and thank you for talking about rare disease here amongst the committee. So speaking as someone there, I'm also serve on the board of the Marfan Foundation. It's a rare disease. It's a genetic-based disease, and so something I would point to is rare diseases are rare individually, but across like the entire country, many people have a family member who has at least one form of rare disease. So they're not rare in collection. The other thing I would say, and we've discussed it here, and we're talking about clinicians, I think the key thing is most clinicians are in their training. The chance of having a clinician who has the training, the CME, the continuing medical education on your rare disease is actually quite low because they can't take training on everything there. What AI can do is help them learn more about the condition, also help them identify practitioners in the area who have more expertise in those and collaborate with those practitioners and get a given patient closer to a site of excellence for that rare disease.
Very good, excellent. Appreciate that information. Dr. Wright, and again, I'm just following up with Dr. Ruiz on this particular subject. Dr. Wright, as chair of the conference, the Commerce, Manufacturing, Trade, and Subcommittee, I'm very interested in protecting children and teens online, as we all are. In that space, there's a lot of talk about how children and teens using online services may face greater risk of suicide, self-harm, and other dangers. One discomforting new trend is the rise of AI chatbots, which we've been discussing, which I'm concerned may exacerbate existing problems of loneliness and social isolation among young people. While still early days, the prospect of children and teens socializing primarily with chatbots and building supposed relationships and even romantic relationships with these new online services is troubling to many parents. Can you speak to how loneliness and social isolation impacts children and teens' development? And what could the long-term impacts be of children and teens interacting primarily with AI chatbots instead of their peers?
Thank you for the question. Yeah, obviously we are very concerned as well on the role that all emerging technologies will have on our children and adolescents. In our recent Stress in America survey, the majority of all adults that included children said that they feel like they can't talk to people about their stress because they don't want to burden them. We also have a study that says that adolescents would prefer to speak with an ambient source like a chatbot than a person because they fear being judged. This is a real challenge in our culture. And yes, it is spurring increased loneliness and isolation. So what do we need to do as a culture to help people understand that coming together and having empathy and having social connections is actually the better solution than turning to these technologies as a replacement for people? They can be a huge tool as long as you use them and then go back to the people that you're trying to connect with. And so if we as parents need to model good use of these technologies for kids, we need to help them understand what the risks of them are, what the business models are, and how that influences how they interact with them. And part of that's going to have to be how we teach this in schools to kids, because again, this AI is not going away. But how do we help people remember that it's personal connection that makes us the people that we are.
Absolutely. Thank you.